Hi, I'm Frances Fernández, Faculty Director for the Healthcare Management Program here at CCAPS.
Field Notes: Healthcare Management Programs with Frances Fernández. How would you describe healthcare management to someone who is not familiar with the field?
Healthcare management is really the driving force behind healthcare. It's the business side of healthcare. While clinicians focus on the clinical side, physicians, nurses, therapists, healthcare managers really focus on the budgeting, the innovation, the day-to-day operations.
In what ways are healthcare managers stepping up to support and strengthen the communities they serve?
Healthcare managers are community builders as much as they're administrators. They partner with nonprofits, with behavioral health organizations, long-term care organizations. They study public health to address the social determinants of health, such as housing and food insecurities, and that all affects healthcare.
Can you walk us through a day in the life of a healthcare manager?
A day in the life of a healthcare manager is never the same. It's always different. It's really exciting and diverse. One day you might be talking budgets and strategy, while another you might be talking advocacy and staffing. So it's really exciting depending on the role that you have in healthcare, always changing, always innovative.
What key traits or skills truly distinguish great healthcare managers from the rest?
A great healthcare manager is adaptive, innovative, empathic, and compassionate. They're going to be taking care of the life of a patient, of a family. Whether you're behind the scenes or in front, you're always going to have that impact. And it's just really one of those things that makes for a great leader.
Where do you see the most promising career growth for healthcare management grads in Minnesota right now?
Minnesota is a powerhouse in healthcare, whether it's long-term care, behavioral health, IT informatics, data analytics, consulting. There's just something for everyone in healthcare. We have great systems, Mayo Clinic, Fairview, Allina, a lot of support organizations, you name it. The field is open.
What are your students going on to do?
Our students are going out to work in a variety of roles, from consultants to data analysts to insurance brokers, you name it, they've done it. Long-term care administrators is just amazing. The field is so broad and there's so many opportunities out there. And we're just so proud of the roles that they're already acquiring right after graduation.
How do internship experiences create real value for both students and healthcare organizations?
Internships are what bridges the learning from the classroom into the work world. Sometimes we call it the real world, but it's really the work world, right? So how do we apply what we have learned and go out there into community and apply it? It's a great opportunity for students to really test out the waters. Maybe they're not sure about what they want to do once they graduate, and they can test out a role, a career without that commitment. And it really also exposes them to great networking opportunities, sometimes lasting relationships. The organizations get the best of both worlds. They get a fresh perspective, a student who's really eager to effect change and learn. It's a win-win for everyone.
What are some of the toughest challenges faced by healthcare managers in today's evolving landscape?
I think one of the toughest challenges that we have as healthcare leaders, healthcare managers, is really staff burnout, the rising costs of healthcare, how it affects our communities, how it affects access, how it affects equity. I think that's one of the things that makes us resilient. We need to be resilient to make sure that we affect change, that we adapt to the changes that are in our communities so that we can tackle those challenges.
How are healthcare leaders using AI and new technologies to rethink patient care or streamline operations?
AI is really assisting healthcare managers in a new way, more innovative, more effective, a lot quicker. We are really streamlining operations, being a little bit more effective financially, and really diversifying the reach of accessibility with AI.
What advice would you give to someone just starting their career in this field?
First of all, stay curious and have an open perspective for continuous learning. Seek mentors, network, ask questions. You're never going to know the path that you're going to take unless you explore it.
Do you have any hobbies?
So I love listening to music. I love gardening. I'm trying to learn to play the guitar. It's not going well.
What's your favorite thing about teaching at the University of Minnesota?
Oh, that's easy. The students. They are just so passionate, eager to learn, hungry to learn, and just having the opportunity to be part of their journey is so rewarding. Just to know that they are the future of healthcare leadership gives us hope.
Field Notes: Learn more about our healthcare management programs at ccaps.umn.edu/HM.